Hey everybody, this is Dr. Sophia, and I am super happy to be here with y'all today. We're going to talk about something that I think is really interesting. But before we get started, I just wanted to share that I'm trying something new today. Hopefully, it's going to work out. I'm actually recording this podcast on Zoom by myself. What I have been doing is going into the studio recording things by myself. That's actually really hard for me to talk to a wall. And so I was like, I think I'm going to try this and see if I can talk to myself in the camera and have that feel a little more natural. As a therapist, I do a ton of Zoom teletherapy, and so I think this is going to work better for me. And hopefully, you'll be able to find this also in a video podcast. So I'm excited to be trying this new thing with you. Um, Today, we're going to talk about something interesting that I like thinking about. It's also part of my work, but I wanted to share with y'all and just give a little bit more information. The question today is, what is sex therapy really like? What is sex therapy? I've had some people ask me, wait, is that when people come into your office and they have sex and they try to figure out how to have sex and you help them when they have sexual problems? The answer to that is a big fat no. I would have my license revoked. There is nothing like that I do. No, that is not sex therapy. So if that's not sex therapy, and it's definitely not in my office, what is sex therapy really like? What does it mean? What is it that we're doing when we say, I'm a sex therapist, or I'm going to sex therapy, or even if you're thinking about, I wonder if I need to go to sex therapy and talk with someone who's an expert around sex and therapy and the two combined topics together. So I just wanted to shed a little bit of light on that today, and I'm going to briefly talk about two case studies also that can hopefully make it make more sense. And there's a ton of case studies out there that I can share, and I'll do that along the way. I've got a few notes here, and so I'm just going to keep looking at my notes to make sure I'm covering everything. So I would say the first thing that sex therapy is really about is building connection. Um, I would let you know that most often what I experience in my office is people coming to me either in a coupleship or it could be an individual. People who are coming to me, and I'll talk about a coupleship first, who their relationship together is very, very disconnected, very detached, really not much into emotional connection or emotional intimacy. And somehow they think that even though they're disconnected and they don't really connect emotionally in a safe way, that or inconsistent way, that somehow they should still be able to have like wild hot sex whenever they want to. I would say that's most often what comes in my office. And so what we have to do at that point is really deconstruct the relationship and see where the gaps are in connection. And we're really talking about rebuilding the connection. Once we start doing that work, what's really fun and interesting is most of the time I never even know, but people are having sex. So building the connection is really what creates the kind of sex life that people desire, whatever that is. And I love when that happens. So a lot of times we never even get to the quote sex therapy because the connection that we're building, sometimes it's the connection emotionally that has never been there, or we're rebuilding it from where it used to be, and then we're making it better, we're making it grow deeper, bigger. And people are just like, oh, wow, this feels good. And then sex comes naturally and organically and authentically, which is what we want. So ultimately, that is a big goal of sex therapy is how can we create this very natural, organic sex life for ourselves, whatever that is going to be. So building connection, I think, is number one biggie. That's the biggie. Part of building connection for a lot of people, especially in American culture, many of us did not grow up in healthy, sex positive households. In fact, most of us, especially if we had a strong religious background and our childhood was very judging, we feel a lot of sexual shame and shame around our body just as having body parts. Even if we're not touching them or doing anything with them. I work with this a lot. This is something that I work with in individual therapy or couples sex therapy. So we have to get comfortable talking about sex, and that might start out very simply. Um, a lot of women actually who I've worked with and who I do work with, especially if they were sexually abused as a young girl, even mentioning a body part, saying the name can really be a struggle. So we have to start wherever someone is. We get comfortable naming what is true for them and starting in a place that feels respectful to who they are, where they are. I might use other language, letting them know that it's okay to use this language when you're ready. And if you don't want to, that's fine too. But I want to take the shame out of any sexual judgment or criticism or experience that someone has ever had. So just getting comfortable talking about sex and our bodies is also another big part of sex therapy. Another really important part of sex therapy is growing in our sexual development. So I'm going to give a couple of examples here. Um, Internet pornography these days is a pretty popular pastime for people. I would say especially young boys, especially men, and a lot of times older men. All of these people are my clients, all of these age ranges. And when we start fantasizing and obsessing about something that's not real, what do you think happens to our sexual development? Well, it gets stuck. It stays stuck right where that is that we are. If I start looking at porn heavily, I become addicted at age 14, my sexual development is not going to keep maturing. I'm going to be pretty stuck. I'm not going to know how to relate to people. I'm not going to know how to participate in healthy sex. I might think I do because I'm copying what I'm watching, but that is fake and that is not real. And so when we talk about sexual development, lots of things can affect our sexual development. Again, being abused can affect our sexual development. Coming from a household where no one talks about sex at all can affect our sexual development. Or if we were taught that learning how to masturbate is wrong, that's bad, 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 that can affect our sexual development. So really, when we're in sex therapy around sexual development, we are learning how to be curious about our bodies. We're learning how to feel safe being curious about our bodies. We're learning how to explore when we're ready. What feels good to me? What does not feel good? What do I like? What do I not like? And again, being able to share this in a session in as much detail as is healthy and appropriate, is a way to really continue our sexual development until finally we are at a place where we are learning to be responsible for our own orgasms, whether it be alone or with other people, that I am responsible for my own pleasure. I am responsible if I want to have an orgasm or not. I am responsible if I don't want to. These are all my choices, and these are the ways that I know how to please myself and how to let my other person that I'm participating in sex with, whether it be a spouse or a partner, it doesn't matter. This is what I like. This is what I want to do. And also learning the confidence of just doing those things with other people. So, sexual development is about doing what feels natural. And I believe that it's a lot easier to do that when we're first learning how to do it by ourselves. I think everything starts here, right inside us. And also, if we are learning how to be in a safe, emotionally connected relationship, it's also much easier to do that in a very authentic, natural way, how to be responsible for ourselves sexually in safe relationships. Now, when we're responsible for ourselves as far as orgasms and our sexual behavior, that doesn't mean we're not also giving to other people and wanting to please them, but it does mean that we're thinking about ourselves first, what feels good, what I want to do, what I don't want to do. That is our job because nobody can read our mind. And so it's really important that we know that our sexual development, that's our job. That's for us to continue throughout the lifespan. So also in sex therapy, we we want to teach people, we want to practice, we want to learn if we're in a relationship how to grow together sexually. So oftentimes, another example of what I will have come in my office is a couple who loves each other very much. Nobody's thinking about getting separated or divorced. There's no big issues on the table, but kind of the spice is gone and they want to rekindle that fire. So again, we're talking about connection. So we're talking about, okay, what can we do for you to feel more connected with each other in a way that might lead to you feeling sexual? And usually when couples are like that, there's been a long focus on family or work. And on our brain kind of goes down this other path where we're not really as connected emotionally to who we're living with. And we kind of get stuck in the rut of day to day. And so we learn how to discuss and talk about ways that people can learn how to be more connected by helping each other feel special and like they matter. So, again, we're actually talking about the things that we do in regular couples therapy. How do we let our partner know you matter to me? How do we let our partner know you're important to me? How do I feel that from my partner? So, these are the things that are really important in growing together sexually. That could be in a long-term relationship or even a newer relationship. Another interesting area with sex therapy is sex and sex therapy can actually also be very helpful in healing past trauma. So I think sex therapy is really important when someone has experienced sexual abuse or sexual trauma. There's obviously going to have to be trauma healing in those instances. But but when it relates to how we learn how to have healthy sex, the second part of that is the sex therapy piece. So the first part is healing the trauma, but then we have to really slow down and create what does healthy sex look like for this person who has experienced trauma. It could be trauma in the relationship, it could be childhood abuse, it could be anything that is affecting what would feel like safe sex. And I mean like emotionally and physically safe sex. So that part of sex therapy is really, really critical for anyone who has ever been molested or abused or sex shamed, body shamed, um, criticized for body parts, anything like that, sexual bullying, anything like that, we've got to really slow down, first heal that trauma, and then really start from scratch, which is what feels comfortable to you? What would feel safe? What would not feel safe? And really working that through and doing a lot of work around that. And if someone's in a coupleship, we're going to eventually do some of that together in the coupleship. And a lot of that work can get done individually for sure. So that's a lot of great healing work to do in between relationships. And finally, and I've already mentioned this a few times, but sex therapy is really great for helping couples deepen connection. So there's 12 types of intimacy. They're all really important. Some of them are, do we share emotional intimacy together? Do we share sexual intimacy together? Do we share financial intimacy together? Familial intimacy? There's so many kinds. But when we are in a committed relationship and we're sticking with someone long term and they're sticking with us, we want our sex to be something that actually grows and deepens. And that's part of deepening intimacy over the relationship or over the lifespan, however you want to look at it. Sex is a tool to deepen our emotional connection, our intimate connection. So we want to be deepening our sexual relationship with people as well. So, sex therapy is about a lot of connection. It's about building connection. It's about learning how to build connection within ourselves and our relationships. So that's a lot of what it's about. Sometimes we're going to talk about sex, and sometimes it's not even about sex. And then eventually it leads to the sex piece of it. So there's a lot of really good work and good connection that happens in sex therapy for people. And if you have any interest in it or any thoughts of, hey, I wonder if this could be helpful to me, or I wonder if this might help my relationship, I really encourage you to check into it because a good sex therapist is really, really helpful. And I think it's a really fun area of work, and it should be fun. And so ultimately, we're aiming at the place of people enjoying whatever type of sex life that they choose to have. So I'm just going to give you a couple of case study examples, and these are things I see a lot. So these are, and again, there's more that I will share over time, but these are pretty common. So here's my first example is I was thinking of an older couple that I used to work with. Older being probably late 60s, 70s, probably more in the 70s if I really think about it. And coming to me pretty late in the game. Um, I think they had done couples therapy off and on for quite a long time, actually. I would say years. Um, the wife, female, never been interested in sex, never liked sex, doesn't know why, has sort of spent her life bearing with it, believing that it was her role, it was the thing to do, because that's what her husband wanted, and it would hurt him if she did not have sex. And the man, wanting to have sex, knowing that his wife did not like it, he still wanted to have sex. um, you know, I think you can probably hear there's a pretty big disconnect there. Um, Also, just a little bit more, this is also really common. Um, the man being more of the person in control in the relationship overall, and the female being more of, um, I would say the follower, and not feeling as confident or smart also. So the man was really in charge. Lovely couple. They loved love each other. I'm sure they still do. Love was not the problem. But really more of this emotional disconnect. Another, this I like to drill everything down. So now you know a little bit more. I'm going to drill it down a little bit more for you. I came to find out this couple really didn't talk about emotions. They didn't talk about anything really ever that was difficult, or when someone died, that it just wasn't discussed. They went to the funeral, that was the end of that. And that's actually true. So life was really lived in a way of we do things together. Again, loved each other. So love was not the problem, that loved each other. Nobody wants to get divorced. But the emotional piece was pretty much, on the day-to-day surface level. And they wanted me to fix their sex life. And so, you know, what we did is we had to focus on learning how to connect emotionally, because that was what the wife needed in order to be able to be interested and want to participate in sex. So we had to start where we needed to start. Um, simply to talk about here's how you pleasure yourself. Here's what you do, wife, sexually. Here's what you do, husband, sexually. That was not going to work. We talked about that. She's already tried everything. We went through any ideas that we could uncover. This was not a physical sexual issue. This was an emotional disconnect issue that was bleeding over into her lack of interest around sex. So we had to really dig in there. We have to, in sex therapy, we have to dig into wherever it is that's affecting the sex. Rarely is it only about sex. I mean, that's kind of a big point I do want to share is that rarely it's only about sex. It is, I'd say 9 times out of 10, it's about something else, usually something emotional, usually a disconnect or a detachment. And so we have to dig into wherever we have to start. So we did a lot of work around helping them learn to share in emotional ways. And it was led mostly by the wife because the husband thought where they were was fine. That's okay. We start where we can. And oftentimes when we do this couples work, if one person is really committed to change and they are willing, able, and committed to being the agent of change, is what I call it, then oftentimes that other partner will follow along, will come through, will follow and fall in line. So that's what we do. We learn how to make the reach and build the connection even when the other person is not meeting us. And we keep going back and we keep going back and we keep going back. And again, when people love each other, eventually that other person is gonna be there for the reach. And so this couple, it was a really beautiful, lovely thing. Um, After a lot of work with this individual, they ended up having a very satisfying sex life, but more importantly than that, emotionally, their relationship was really starting to blossom and is still growing. So that means their sex life is actually going to keep improving from here forward because that emotional connection for the wife was finally present. And the husband's also much happier. So he may not have known that he needed that, but he did. And so, again, all of this through what someone comes in with a problem around sex. And again, the point of this is that a lot of it's around building emotional connection. Um, Another example I want to give is actually with a younger couple that I used to work with. They had a few things going on. The female grew up in a very sexually shaming religious household, and sex has always been bad. And bad meaning I'm bad, like that's the word bad. Um, and and it's not been something that she could get past. And she's done a ton of therapy. So part of this was really helping the female heal from her trauma, her religious trauma. She was also abused. So there was a lot of trauma there that we had to work through individually. And part of the sex therapy, before we could even get to the sex therapy, again, it was this emotional piece where the husband, his sex therapy was really learning how to um, be patient, be kind, understand this is not about him. Most people want to make it about them. It's not about them, but also learning how to slow down and do less when it came to sex and touch, doing much less, sort of, doing work with him to teach him that if he can slow down now, he will get more later. So that's also a sexual maturity you're hearing there. That's part of sexual development is sexual maturity. So a lot of emotional work there with this couple. And again, this couple, they love each other very much. Nobody's talking about getting divorced. So the commitment's there. The time to spend in this is there, which is important. So that's an important thing for me to mention is sex therapy, occasionally it can be a quick fix if we're talking about certain types of erectile dysfunction, or if we're talking about certain types of pain during sex, that can be a quicker fix. But when we're talking about these couples issues that usually are born in some kind of emotional disconnect or conflict, we have to learn to kind of stay with it and know that the sex piece is going to improve as we continue to do the work. And this couple, again, another really great outcome for them when they could both learn to focus on themselves and stay present with themselves. Sex became much safer for both of them. Sex became much slower when it needed to be. The wife got much more comfortable with her own body and felt less sexual shame. The husband became a much kinder lover that she needed. And when he learned to slow down, he actually learned to enjoy sex more. And so both of their sexual development was was moving on its course, and their sex life was able to become something that they'd really never experienced before together or with other people. And their relationship really grew and became much, much more loving in all kinds of ways because the emotional safety piece was present for both of them. And the connection work that we did a lot of encountered centered couples therapy, a lot of EMDR, really, really deep, helpful therapy. And then the sex therapy kind of fell in line. And that was the easy part. And so it was just a really lovely experience for them. And I'm just super proud of them. So anyway, I think I'm going to talk a little bit more about this in some other podcasts, and I hope this has shed a little bit of light about what is sex therapy. No, we're not doing any sex and sex therapy, but are we talking about it? We are talking about it a lot. And we are also getting comfortable talking about it. I am a firm believer if we can't talk about it, we don't need to be doing it. And we need to slow down and figure out why am I uncomfortable about something that is so natural. Let me slow down, not feel shame, but let me be curious. Why is this hard for me to talk about? And sex therapy is a great place to figure this out, to do it at your own pace, and learn how to be healthy and happy in your own sex life, however that looks. And so I hope this has been helpful. I look forward to seeing you again next time. Have a great rest of your day. Take care. Bye.